Hi everyone, Ashlyn Giza YouTube channel. Today I'm going to talk about C-sections and births. So, my C-section, I was really scared because I never had a C-section before. So I was freaking out and I didn't know what was going to happen and was wondering, am I going to be awake during the procedure? Are they going to knock me out completely? Or what is going to happen to me? Um, am I gonna wake up? Am I gonna pass out? Am I gonna feel the cuts when they're cutting me open? All these thoughts and feelings were running through my head. Um, but I didn't really have anxiety until it got closer. So, and usually I'm a person who will dwell on something for a long time, but for some reason I didn't have anxiety until like really when it got close. But nonetheless, the night of my C-section, or I should say morning, because I had to go in at 6 a.m. and my C-section was scheduled for 9:30 a.m. So what they did was the night before they had me fast, but since I'm hypoglycemic, which I talk about hypoglycemic and hypoglycemia in other videos that I made, it'll explain what it is and stuff. But since I'm hypoglycemic, they let me have glucose tablets and a little bit of juice, so that way I wasn't like passing out or, having to go to the hospital for an emergency or anything like that, or falling and hurting the baby. So I got to have a little bit of juice and sugar tablets. Then I went into the hospital. They hooked me up to IVs and they just kind of helped me relax and talk to me about different medications I take on a daily basis. And they talked to me about like what, just like try to keep me comfortable, like ask me what we were going to name the baby and if we knew if it was a boy or a girl and things like that, and kind of went over the procedure of how they were going to go about this C-section. So um what they told me was exactly what happened. So and they also rubbed this orangey type stuff on my belly where they were going to cut the make the incision. So it was extra, extra clean, and they had me take a shower before I came in. But even though I took a shower, they still wanted to make sure, that it was very sterile where they were making the incision. So they clean the area there, and then if you need to be shaved or anything like that, they'll shave you down there in the area too, the pubic area. And then after that, they'll take you to the back surgery area where they do the C-sections for people. And then I talked to the surgeon herself, the guy who gave me all the like anesthesia medicine type stuff, and some of the nurses and stuff. And when they were sitting me down, sorry, I have some glue left from yesterday on my eye because sometimes I'll wear false eyelashes. But and I haven't washed my face or anything really, and nonetheless, I need to do that here soon. But so anyways, I was talking to all these people and they were freaking me out. I was about ready to pass out because here I'm already having anxiety about the incision, and then I got like 4 or 5 people standing up over me, literally, because they had me and my husband sit down in these chairs at the end of the hallway, right next to the um, C-section room. And they're all talking to me kind of like at once. This person's talking, and then the person after that person's talking. And then I had to actually stop. Then I'm like, hold on a second. I'm like, I think I'm gonna pass out. I don't really feel good. And they're like, okay. And they kind of like sat there for a moment and said, it's okay, and stuff like that. And then So after that, I'm like, okay, I think I'm okay. They're like, it's okay, don't worry. A lot of people feel that way, and we've actually had people pass out before and stuff like that. But you're in the right place for that because you're in the hospital, and a lot of people get anxiety before the C-section. So that made me feel better. But then after they talked to me about everything, they took me back to the room and they set me down on this cold metal bed. Um, and they had me sit and lean forward and kind of like hunch over like this, and I had to hold myself. I don't know if you guys can see me doing that really good. And they stuck the anesthesia down below my lower back kind of area. And then they helped put my legs up and stuff like that. And then they I had a mask on and a hairnet thing too, and I couldn't wear any makeup. We're not supposed to wear makeup in there. And it's weird because I've seen other girls wear makeup for their C-section, and I was like kind of upset because I thought, okay, why is I'm seeing everyone's wearing makeup, I can't wear makeup. I wasn't too mad, but I was, when you're taking pictures and stuff, you want to look presentable. But here I was, absolutely no makeup. But here I am talking to you guys with no makeup too. But I mean, I wanted my birth pictures to be nice, as do most women. But so they laid me down, and I had a mask on because of stupid COVID, and the hairnet thing, and the guy I think is giving me kind of medications as they're cutting me open and stuff. I'm not really knowing what he's giving me because I'm not quite sure if it was just more like numbing medication for down below or what, but I kind of started feeling a little funny, and I told them that and they said it was normal. Lots of girls prior to my C-section, like online, when I was asking people what they felt like, they were saying they felt like they kind of couldn't breathe. But I found that for myself anyways not to be true at all. I think what happens is you're kind of sedated somewhat from all the medicine that they have to give you to numb you down, from your waist down, that you feel like you can't breathe, but you're breathing just fine. And if you get that mindset, and you think, hey, okay, I'm breathing, I can see my oxygen level, because for me, I don't know how every other state or country does C-sections, but for me in Iowa, they have the monitor thing right by your head, so you can see your oxygen, you can see your heart rate, you can see your blood pressure, and all that. Um, and the doctors and nurses and everyone are all around you to make sure you're perfectly safe and that nothing's going to happen to you. And I knew that before, but like, just like everybody, your mind makes you think the worst things ever are going to happen. Or that some freak accident's going to happen to you, something that's never happened in life history before. So, but it went really good. My oxygen and my blood pressure and everything looked like it was pretty steady, but there were a couple times he saw my blood pressure drop, so I think he had to give me medication for that. I don't remember because they had an IV in me where that was open, so he could keep injecting different things if he had to. But it was a good birth because I was joking around with him about college football teams that we like, because he was wearing a team that I don't really like so much, a college team. And I don't know if I could say it or not, because again, I don't want to get in trouble or sued for something that I said that I didn't know I was supposed to. But the Iowa Hawkeyes is my team. I love them to death. And then he was wearing an Iowa State head cover and mask. And I was kind of joking around with him about that, about those two teams, because I don't like Iowa State, but Anyhow, so that was kind of funny too. That was happening while they were cutting me open. Um, then after a couple minutes, it felt like seconds to me because I was kind of loopy from everything. My husband comes in and he's up by my head and he said, "How are you doing, honey?" And I said, "I'm doing good. I'm not afraid and anymore, and this isn't how I thought it was gonna be. It's not that scary." And he said, "Good." And so they said, "Okay, we're gonna cut keep cutting." And I just, of course, laid there. And then my husband was kind of peeking around, but I don't know if he wanted to actually see them cut me open, so he kind of was just looking at me and stuff. And then they said, "Okay, we're gonna kind of tug, and you're gonna feel some tugging and pressure." And then I could kind of feel the tugging and pressure, but no, there was no pain at all. You just could tell that a baby was coming out of your stomach. That sounds painful, but it actually wasn't, just because all the medicines they give you. So no, don't have anxiety like I did. Enjoy your pregnancy, and don't the night before you go to bed and everything for the C-section, don't worry about anything because it's so fast. It's just over with. It only took about 25 minutes for everything, for is from when I went right back to the room, laid down, and them cut me open and pulled the baby out and everything. 25 minutes. That's it. That beats my 30-40 minute labor with my other two kids, because I had regular births with my other three kids, but my other two kids were 30 or 40 minutes. And then my first daughter, when I was like 17, she was 13 hours of labor and pushing, including. So 13 hours altogether, 40 minutes, 30 minutes, and then 25 minutes for the C-section. So C-sections definitely beat natural birth. Let me tell you that. But I'm not against people who have vaginal births or choose to have C-sections. I'm not one of those people. I don't care what anybody does. That's their business. That's their baby. They should be able to choose if they want a C-section or not. In my situation, I actually chose C-section because, again, in other videos that I've made on YouTube, I talk about how I'm a cancer survivor. So with all my health issues and everything, I didn't want to even try that route of a natural birth. So I told them that, hey, I need to do a C-section. Plus, and in other videos too, I talk about how I had the Esure birth control, and I had those coils removed. So um, with the Esure coils, if you had them removed like I did, and you had them removed successfully, sorry, to have a chance of having a pregnancy, on to have a high risk of having a pregnancy or a baby, what happens is they more or less want you to have C-sections. My surgeon did. Because what happens if you have a C-section, if you don't have a C-section after you have the Esure coils removed, you could have uterine rupture, which is like your uterus rupturing. You could have a hemorrhage. You could bleed out, bleed to death. So definitely, if you've ever had the Esure coils removed, you do not, and you're trying to conceive, and you do conceive, you want to try to get a C-section. And if you have an OB or a doctor that's saying, no, you can try to push, you can try to have the baby naturally, you say, I want a second opinion, or go get a different doctor, because that is we're at the Esure coil removal people that have had those out and have a baby. We're at high risk of having uterine rupture after. I don't exactly know why or remember. I would have to contact my doctor to um, know the exact reason why that could happen if you have the Esure and you have it removed and then you have a baby. I'm not really sure why that could happen, why that's a risk. But I just know it is one, and they told me that that's what could happen. So, I mean, I would talk to your doctors about it if you had Eschers in like me, and then you ended up pregnant. But I wouldn't, in my opinion, advise anybody to have a natural birth if they had the Escher coils removed. Just because that who wants a uterine rupture and bleed out? Like, not me. So, but my other births went really well. I had I went into natural labor with two of them. One of them I had to be induced, and the day that I went in to be induced, they were gonna give me I forget what the medication's called, pitocin or something like that, or whatever, to get me going, but they ended up not having to because my water broke, and I ended up going into natural labor anyway. So um, they were all pretty much natural labor except for my C-section that I talked about. But I would not worry. I would not have anxiety, but easier said than done, because even though you're watching this video, you're probably still going to have anxiety anyways. But I'm trying to ease it by telling you I have panic attacks, major panic attacks. I actually have medication for it. And I even was freaking out a little bit, but I was doing it for absolutely nothing. So, me and my husband are going to try to conceive again in the next year and a half, 2 years. And I'm not going to be afraid this time at all. Just because, I mean, now I know what's gonna go down, what's how it's all gonna happen. So, but that's my story on C sections. And if you guys have any questions or anything like that, um, to ask me, or because I might not have thought of everything that I needed to tell you guys about a C section, but if you guys have any questions or your C-section stories to tell, I would love to hear them. So drop them in the comments below. And I would love to have more subscribers and comments, interactions on my videos. So um, go ahead and subscribe if you'd like to, and drop comment below if you'd like to. I'm glad that you guys are tuning in. Thank you for watching. I'll be on with another life topic tomorrow. Thank you.